Have you ever wondered why so many people suffer from diabetes? Today in this video, I'm going to explain exactly what diabetes is, some of the consequences of diabetes, and most importantly, what you can do to prevent it and improve your overall health. Hey there, I'm Dr. Anna. I'm a medical doctor, and on this channel, you are going to learn how to master your health with the right moves. So let's dive into talking about what diabetes is all about. So a lot of you may realize that diabetes is a chronic disease, meaning it lasts for a long time. And a lot of you might be aware that it has something to do with your hormones. And that's all because insulin is not either working well enough or there isn't enough of it. And there's a few kinds of diabetes, so let's quickly just break them down for clarity's sake. We have type 1 diabetes, which is an autoimmune disease, meaning you have your immune system that's actually attacking certain cells in your body that are producing insulin, which is the hormone that helps bring our blood sugar back down. And this is all happening in the pancreas. So people who have type 1 diabetes cannot make insulin because their own immune system attacks the cells that make it. So typically we're going to see somebody with type 1 diabetes have these symptoms starting from when they're even a baby or just a child or a teenager. Instead, type 2 diabetes is a developed condition. Now, old school thinking was we called this adult onset diabetes because this is where you can make insulin, it just doesn't work as well. But that's actually not good terminology to use anymore because now we're seeing the type 2 diabetes present even in kids. So I like to just think of this as the acquired diabetes, where something's going wrong in your metabolism and in your hormone system, and all of a sudden your pancreas can't produce enough insulin anymore. We also have gestational diabetes, which is the diabetes that comes on when a woman is pregnant. Sometimes, and usually, it does go away when that pregnancy ends, but it doesn't always, and it can really increase someone's risk for developing type 2 diabetes after that pregnancy finishes later on. So the issue with diabetes is the following. You have insulin. Normally, in a healthy person, there's enough insulin made so that after you eat a meal, your blood sugar goes up because you ate sugar in your meal, and then it comes back down. And why does it come back down? Because insulin is able to help you take that sugar and put it inside of your cells. So if there's not enough insulin, you can't take the sugar from your blood and put it into your cells. And what's going to happen? Well, that sugar stays hanging out in your bloodstream. And we know that glucose, which is the main molecule of sugar that's in our blood, can cause damage when it's in our bloodstream at too high of a level for too long. So what does this mean? The kind of damage that can come from diabetes that is unchecked is where it can damage the smallest blood vessels first, in your kidneys, in the retina of your eye, your toes or your fingers. So these are the common things you're going to see in diabetes. People who start to have kidney disease, people who start to have problems with their vision, people who have to get a toe amputated because it goes unregulated and unmanaged for too long. Now, the truth is, it doesn't only damage the organs themselves. High amounts of sugar in your blood are also going to damage nerves. And this is where it can be very painful for someone with diabetes. When they start to have nerve damage, that can happen at the level of their fingers and toes, and it even can progress higher up. Now, in the most extreme cases, the damage is so severe that people completely lose the sensation in their fingers or their toes. And I don't know about you, but if you've ever burned your finger on a hot pot or on the stove while you're cooking, that pain causes you to move your hand away so you don't damage the tissue. So imagine not being able to feel if your finger is being burned. You really do burn off the flesh. And these kinds of things are really devastating. If you can't feel your fingers or your toes, you're so much more likely to have damage or trauma occur to them without you even realizing it. As I mentioned, with the blood vessels in the retina or the back of the eye being damaged, when that is so severe, it can even lead to blindness. Now, if you're finding this information useful so far, and I really hope that you are, please subscribe to this channel. I'm trying to get this information out to as many people as I can, cost-free, because I think that this is really valuable for you to know and for your loved ones to know. So that was all doom and gloom up until now, but here is the good news. A lot of cases of type 2 diabetes, which is the most common type, are preventable with the right lifestyle interventions. In other words, the right moves. So let's talk about what these moves are that can help you decrease your risk for diabetes or improve the condition of diabetes that you might already have. So I like to think about this as creating a big soup. It's not one specific thing that's going to completely make all of the change, but it's actually doing several of these actionable steps together that's going to improve your health for the long term. So you can think of it like the different ingredients in a soup. The goal is to make the soup that will help lead to longevity and preventing a lot of chronic disease so you can thrive until your latest years. So we do want to target all of these things. What are they? The first ingredient is going to be healthy eating. Now, healthy eating is a major topic, and depending on who you ask, you might get completely different answers. So you might be wondering, well, what do I mean by that? If you've ever seen other content I've made on this channel, you're going to know that I'm a huge advocate for the Mediterranean diet and lifestyle. And it has been shown time and time again in so many research studies in different places around the world to be very beneficial for the prevention of type 2 diabetes. And this diet is very classic because it is helping us decrease inflammation in the body, helping us lose weight, and helping us regulate our blood sugar and our metabolism, which are all very crucial components of diabetes management and prevention. So if you're brand new to the concept of the Mediterranean diet, here's the gist. It's a diet rooted in whole foods, mostly plant-based foods, but also rich in very healthy fats like olive oil, fats that come from fish, and including lots of fibrous foods like legumes, beans and lentils, nuts and seeds, and whole grains, and then also including animal products for protein source, things like eggs and dairy, especially high protein dairy sources like Greek yogurt, to a lesser degree, poultry like chicken or turkey, and to an even lesser degree, red meat. And the Mediterranean diet's a little bit famous for also including some wine. Now, that's actually debated currently in the medical research about what the role of alcohol really is for some of these chronic diseases like diabetes or cardiovascular disease. What I can tell you is it seems like a little bit might be okay or even beneficial, but the best thing is to have none. So you have to decide what's right for you when it comes to that. I know alcohol is a huge part of celebration, and it's really important in many cultures around the world and even many religions. So there's a time and place for everything. But healthy eating is not the only ingredient in our longevity soup here and for our diabetes prevention. We also want to make sure we're targeting exercise. And that's because obesity is one of the leading risk factors for diabetes. So exercise is crucial for helping us lose weight and manage a healthy weight. And this is the thing most people don't think about. Everybody needs to be exercising. It's not just something that people who are overweight or dealing with obesity are needing to do. All of us need to do it. All of us, all of the time. So we want to make sure we're getting enough balance of having good cardio exercise, so stuff that gets our heart pumping, easily done from things like swimming or bike riding or jogging or doing something even more extreme of a sport like hiking or skiing, and then having enough weight-bearing exercise. This can be done from things like weight training in a gym, but it doesn't have to be. Depending on the type of job you have, you might actually be lifting heavy things already in your normal work. We just want to make sure we have a good balance of those things because at the end of the day, diabetes is really a metabolism issue, and there's nothing better for metabolism than having healthy muscles. Now, there's another reason we want to be able to do things like exercise, and I mentioned it's to maintain a healthy weight. But here's the kicker. Weight management in and of itself is one of our ingredients in our diabetes prevention soup because we know that having a lot of adiposity, especially around the abdomen, that is also going to worsen somebody's diabetes. There's a lot of reasons for that, and part of it's due to inflammation. Others are due to specific signalers that are sent from the fat cells. We don't need to get into all that nitty-gritty science here. We're just here to learn how to apply healthy living practices so that we can actually have the health benefits. But what you need to know is that even a little bit of exercise is known to help improve what's called insulin resistance, which is often an underlying cause of the type 2 diabetes. Now, our next ingredient in our healthy diabetes prevention soup is going to be managing stress. And this sort of plays into all of the other factors. I like to think of it as chicken and egg. If you're feeling really stressed out, you might not have enough energy or enthusiasm to take care of your health in other ways. You might not be interested in eating very healthfully. You might be dealing with sort of binge eating behavior where you feel stressed, so you reach for these really high sugar, high fat, high salt food items that give you momentary satisfaction. Maybe when you're stressed, you're actually not motivated or enthusiastic or feeling enough energy to go and exercise the way you probably should. This is a challenge. And we know that stress is a vicious cycle situation. And the more chronic stress we feel, the less likely we are to take care of ourselves. And then it adds to more stress because we're not only feeling guilty or maybe upset about that, but our body starts hurting and feeling the consequences, and it just gets out of control. So this is one of those things where I can't encourage enough. Talk to someone, talk to your healthcare provider, a counselor, even someone at work or in your family if you're comfortable. If you're feeling excess stress, get help. It might save your life. And the last ingredient of our longevity soup here is to get regular health checkups from whoever you normally go to as a healthcare provider, be it a doctor, a nurse practitioner, someone that you really trust and who's been tracking you over time. Because we want to make sure we're getting our lab work done, we're getting a check-in with how we're doing, our medications are regularly managed. Like a lot of other chronic diseases, diabetes can develop over time. And once we start detecting that there are risk factors in place, and we start noticing changes happening in our health, maybe that we're unaware of. We might not have symptoms yet, but it might come up in the blood work, for example. A lot of you who have diabetes, you'll know about HbA1c. This is the blood marker we often track to detect the severity of diabetes. So if you're having all those things managed, that's very crucial for knowing what path you're on. Are you on a path, if you don't have diabetes yet, to develop full-blown diabetes? Are you on a path where if you do have diabetes, it's getting worse? You really want to know where you're at. And I can't encourage enough to get these checkups because it could save your life. Now, I'd like you to comment, share below with us. What things are you doing now that are really helpful for you to manage or prevent diabetes in your own life? Which of the things that I talked about are you applying, and which are more challenging for you? The more we share, the more we can encourage each other to adopt healthy lifestyle habits so that we build this really vibrant community. And those of you who've already engaged in the comment section on this channel, thank you so much. You've been doing a fantastic job. I love reading your comments, and I do read every single one. And if you found this video helpful so far, please consider sharing it with somebody you think deserves to learn this information, be it a family member, a friend, or a loved one. Now, if this has just been really stimulating you and you can't wait to get your hands on more information about tips and tricks, how to apply healthy habits, a healthy eating pattern like the Mediterranean diet and lifestyle, I got tons of videos for you on this channel. You're going to love that information. I'll see you over there.